Welcome to the RN Toolkit, your go-to resource for practical knowledge in nursing. Today we're diving into a fundamental yet often complex area of patient care, nutrition in health. As nurses, understanding how nutrition impacts our patients' well-being, disease prevention, and management is absolutely crucial, regardless of our specialty. It's a vital tool in our toolkit. Let's start with the foundational building blocks. Nutrient reference standards. Think of these as guidelines or benchmarks that health professionals use. One comprehensive set is known as the dietary reference intakes. This isn't just one number, it's a collection of different standards designed to help us assess and plan diets. You might hear about terms like the adequate intake or AI. This is used to help estimate a person's daily nutritional intake. Then there's the recommended dietary allowance, or RDA. This level is designed to meet the needs of most healthy individuals. We use the RDA when planning for individuals to ensure a low risk of nutrient inadequacy. Another important standard is the estimated average requirement, or EAR. This represents the nutrient amount estimated to meet the needs of half of healthy people in a specific group. It's particularly useful when assessing the nutritional status of groups, like residents in a long-term care facility. We also need to consider the tolerable upper intake level, or UL. This is the highest level of daily nutrient intake that's unlikely to cause adverse health effects for almost all healthy people. When we plan diets for individuals, the goal is to not exceed this level. It's worth noting that you typically wouldn't reach the UL from just eating unfortified foods. It's more relevant when considering supplements or fortified foods. Finally, within these guidelines, there are acceptable macronutrient distribution ranges, or AMDRs. These provide recommended ranges for carbohydrates, fats, and protein as a percentage of your total daily energy intake. Adhering to these ranges is associated with a reduced risk of chronic diseases. So how do we use these in nursing? We're not usually calculating exact requirements in real time at the bedside, but these standards inform the work of dietitians we collaborate with, and they guide our understanding. We use them alongside dietitians to assess a patient's nutritional intake and plan dietary interventions. Assessing someone's usual intake can be tricky due to things like reporting errors, but we combine dietary information with other crucial data, like laboratory values, physical assessments, diagnoses, and overall clinical status, to get a complete picture. When planning, whether for an individual or a group, the goal is to recommend a diet that provides adequate nutrients without being excessive. We often use food-based guides to help teach patients how to make healthier choices based on these nutrient principles. Understanding eating patterns is also key. Not just specific nutrients, but the way people eat matters. We look for patterns associated with positive health outcomes. These often emphasize vegetables, fruits, legumes, whole grains, lean proteins, and healthy fats. Conversely, we need to identify and help patients modify detrimental eating patterns that can contribute to health issues. Looking at the bigger picture, we can consider diet quality across the population, which studies sometimes show could be improved. This is why national health initiatives are so important. One such initiative is Healthy People 2030. Led by the U.S. Department of Health and Human Services, its main purpose is to improve the health and well-being of all Americans. It acts as a vital blueprint, setting specific public health goals and objectives, and then monitoring the nation's progress towards meeting them. It places a strong emphasis on nutrition as a way to tackle major health challenges, particularly focusing on areas like nutrition itself, obesity, and the prevention of chronic diseases. It helps us understand national priorities in health promotion. This brings us directly to the connection between nutrition and chronic disease. Poor nutrition is one of several modifiable lifestyle risk factors that significantly contribute to the development of chronic conditions like diabetes and cardiovascular disease. Other modifiable risk factors include tobacco use, excessive alcohol consumption, and physical inactivity. As nurses, we are on the front lines of educating patients about these factors and supporting them in making changes. Increasingly, healthcare is embracing lifestyle medicine. This approach uses evidence-based lifestyle changes, and nutrition is a huge part of this, to treat, and in some cases, reverse or prevent chronic diseases. It involves things like regular physical activity, getting adequate sleep, stress management, and avoiding risky substances. Importantly, it emphasizes the patient as an active partner in their own care journey. It's a long-term commitment, not a quick fix, focusing on sustainable healthy habits. Looking ahead, emerging fields like Nutrigenomics are exploring the fascinating interplay between our genes and our diet. The potential benefits include the possibility of highly individualized dietary advice based on a person's unique genetic makeup, the development of foods tailored for specific health benefits, and potentially reducing health disparities linked to diet-gene interactions. While not yet widely applied for most consumers, it represents an exciting future direction in understanding nutrition's impact. In summary, nutrition isn't just about food, it's a critical component of health and disease. As nurses, understanding nutrient reference standards, recognizing the impact of eating patterns, being aware of national health goals like Healthy People 2030, identifying modifiable risk factors, and appreciating the principles of lifestyle medicine equips us to provide more holistic and effective care. We play a vital role in assessing nutritional status, educating patients, and collaborating with other healthcare professionals to help individuals achieve better health through nutrition. That wraps up this episode of the RN Toolkit. We hope this quick look into nutrition and health has provided valuable insights as you gather the tools to take with you into your future nursing careers. Join us next time as we explore guidelines for healthy eating with a focus on MyPlate, a powerful tool. Subscribe to RN Toolkit for more videos like this.